Now we are going to introduce Miss Emily Morehead. If you guys weren't with us last time, Emily is a LPC. She's the clinical curriculum developer at the Gladney Center for Adoption. She served at Gladney for 5 years, working alongside adoptees, birth parents, and adoptive parents. Her passion is empowering through education. She has experience walking alongside individuals navigating infertility, adoption, parenthood, postpartum support, grief and loss, trauma, couples counseling, boundaries, estrangement, relationship patterns stemming from childhood, as well as general life difficulties. So she is very experienced in all things counseling, and she is going to share her expertise on grief and depression. So without further ado, Miss Emily Morehead.
Thanks, Jenny. I'm excited to be on with you guys today. Like Jenny said, I'm an LPC, and so I've had some dabblings in working in child advocacy centers, working in obviously at Gladney, an adoption agency, and then have worked private practice before, and then currently have a little side hustle of a private practice called The Couch. And so really and truly, one of my passions is working with individuals who are trying to understand grief and trying to understand how it impacts their daily life. And grief is a topic that I think a lot of people are uncomfortable with. And I'll be honest, we were pretty surprised with the webinar attendance just because it's a heavy topic. And right now, the world is pretty heavy. Awesome. So 76% of you guys did not attend that webinar and 24% of you did. So we're going to link my last training for you guys today before you log off. So you have a tool. It's just on YouTube. It's a really easy watch. You didn't have to attend that training to be a part of today's conversation. Today's conversation is very independent of that training, but it also is a really good building block if you decide that you want to log on later and build in some more grief knowledge. So last time we chatted, we really talked about cultural implications of grief and how we integrate that into the way that we serve, we love, and we care for grievers. And we heard from a lot of grievers, people who were actively grieving that attended and just really appreciated the normalization of their grief. And so if you're interested in understanding more about our cultural implications of grief and understanding diagnostically how to differentiate depression and grief, that is a really great webinar for you. Again, we'll link it today. And really what we're going to do today is we're going to dig into what treatment looks like. Specifically from the lens of caring for and tending to a griever. You're going to hear me use the word tend a lot today. Tending is different than fixing. So we're going to really be immersed today in talking about how we tend, how we care for people who are grieving. I'm a therapist, Jenny is a therapist, but you do not have to be a therapist to be welcomed onto this training today. This training is for professionals and people who are grieving and people who love people who are grieving. So all of your grief, all of your experience is welcomed here today, and it's a safe place for it. When we talk about grief, though, we have to acknowledge how it can affect our body and our mind. And so today, if this training just hits any trigger points for you, if some of the information is hard to process, if you're finding that you're feeling heavy during or after the training, we really suggest doing some self-care and taking care of yourself. If you, decide after this training that seeking out a therapist could be helpful, Gladney University team would be happy to connect you in any way with resources in our area, because obviously we're going to be talking about some heavy things today when we're talking about grief. So log off if you need to. Take care of yourself afterwards for sure. So today, while we're talking, I think it's important that we mention, obviously, what grief means. And we talked about this in my last training a lot. But I want you to hear me say, because 76% of you guys weren't on last time, I want you to hear me say that grief belongs to the griever. So if you are experiencing heaviness, if you're experiencing suffering, if you're just experiencing a difficult time and you wonder, is this grief? I want to give you permission today that grief belongs to you and you get to decide what grief is. So when we look at grief researchers and grief literature, what we know is that there is obviously death grief, and that's typically culturally what we think about when we hear the word grief, is that someone died, so we are grieving. And yes, we are going to speak to that lens today, and we're going to speak well to it. We're also going to be talking about grief from the lens of ambiguous loss. And what ambiguous loss is that something happened, you lost something, and life never returned to normal, right? We could even tie in what trauma looks like in that, and implications of trauma with grief. But something happened, and the world will never be the same because of this experience. And an individual, let me get that out, an individual is grieving because of that experience. So yes, death loss is grief, and loss is grief. And those can live together, and they can be grief. So if you want permission for a struggle, a suffering, and you want to know if this is grief, it is. It can be whatever you need it to be. So today, when I speak of the lens of grief, yes, those two worlds exist, and we'll integrate those today and what that looks like. I also want you to understand that grief is not one emotion. It is not one diagnostic feature. It is not one set of symptoms. Grief is grief, and it's a spectrum, and it's a roller coaster. So acknowledging all of that, the idea behind today is understanding grief exists, and here's how we can decrease suffering and increase support systems is what we're going to walk through today. So I'm going to kick us off with my favorite video, my favorite grief writer, Megan Devine. I'm gonna reference her all the time today. She was my first big intro into grief. I'm gonna talk about her. You're gonna own the book that she wrote, It's Okay That You're Not Okay, before the day is over. Put it in your Amazon cart, like it's gonna happen, because she is wonderful. And this is a video that she developed called How Do You Care for a Grieving Friend? So take it away, Jenny.
Can you all see that?
I can.
You can? Okay, perfect.
So what do we do about all the pain we see in the world? All the pain we feel in our own lives? And why does it seem like our best efforts to help somebody feel better always backfire? I've been studying intense grief and loss, baby death, violent crimes, accidents, suicides, and natural disasters. And I've learned something really interesting. Cheering people up, telling them to be strong and persevere, helping them move on, it doesn't actually work. It's kind of a puzzle. It seems counterintuitive, but the way to help someone feel better is to let them be in pain. This is true for those giant losses and the ordinary everyday ones. Educator Parker Palmer writes, "The human soul doesn't want to be advised or fixed or saved. It simply wants to be witnessed exactly as it is." He's talking about acknowledgement here. Acknowledgement is this really amazing multi-tool. It makes things better even when they can't be made right. For example, somebody's struggling. Their baby died, or there's been a bad accident, or their mom got sick, and they're just sad. It's way more helpful to join them in their pain than it is to cheer them up. But here's what we tend to do instead. You have 2 other children, you need to find joy in them. Or, you know what you need? You just need to go out dancing and shake it off. Or, I felt really sad once. Did you try acupuncture? We're not really sure what to do with someone's pain, so we do what we've been taught. We look on the bright side. We try to make people feel better. We give them advice. It's not like this is nefarious. I mean, we try to cheer people up because we think that's our job. We're not supposed to let people stay sad. The problem is, you can't heal somebody's pain by trying to take it away from them. Now, acknowledgement does something different. When a giant hole opens up in someone's life, it's actually much more supportive to acknowledge that hole and let pain exist. It's actually a radical act to let things hurt. It goes against what we've been taught. In order to really support you, I have to acknowledge that things really are as bad as they feel to you. If I try to cheer you up, you end up defending yourself and your feelings. If I give you advice, you feel misunderstood instead of supported. And I don't get what I want either, because I wanted you to feel better. It's pretty rare that you could actually talk somebody out of their pain. Rarely does the admonishment to look on the bright side actually heal things for someone. It just makes them stop telling you about their pain. It's so tempting to try to make things better. When somebody shares something painful, it's much more helpful to say, "I'm sorry that's happening. Do you want to tell me about it?" To be able to say, "This hurts," without being talked out of it, that's what helps. Being heard helps. It seems too simple to be of use, but acknowledgement can be the best medicine we have. It makes things better, even when they can't be made right.
Ugh, I always tear up during that video. I think that my favorite thing about Megan Devine's work, and specifically when we're referencing that video, is that I immediately feel so uncomfortable because I think that our natural inclination, our culture's natural inclination in grief is that we want to fix it. We see a problem, we want to fix it, we want to make you feel better, we want to cook you lasagnas and put them in your fridge and just like fix it for you. And all of her work, and really and truly a lot of the grief research shows that by fixing it, by offering advice, by comparing grief experiences, all we're doing is making that griever feel like they are not heard. And it's the most uncomfortable statement that she makes in that video, but it's the radical notion of letting something hurt. And I don't know about you, but when I started digging into her work and I felt that grind of no, I have to fix that hurt. As a therapist, right? As a human who doesn't want my people to hurt, like I just want to fix it. And it's fascinating that really all of the treatment that we're looking at, when we're talking about with the treatment implications of healing, is letting hurt exist, which seems so simple and is completely difficult for us because our natural implications and our cultural implications of dismiss, deny, it's going to get better, rainbows and sunshine, you'll come out better for this. When the treatment says that that actually just increases a griever's experience of not feeling heard or supported. And so today during our training, we're going to use the working model that Megan Devine proposed of tending and suffering. So what she says in her book is that pain gets supported. We're going to let pain exist. Pain's allowed to exist. The griever is allowed to express pain. Anything that is suffering, we want to build in support systems too. So I'm going to talk with you guys about like how we look at the difference between what pain and suffering is and how we walk with grievers in understanding what that looks like for them. And I hope that you heard me say walk with grievers in and not teach grievers, because the last thing a griever needs is to be told that they're doing it wrong, right? So what we want to understand is we want to understand as humans who love grievers, who support grievers, that there is a difference between pain and suffering, and there is ways to add in support for grievers. So we want to look at what suffering is, right? And suffering is basically derived from feeling dismissed or unsupported. So when we're trying to figure out why I feel this way, why I'm not grieving well, why I feel terrible, why I can't get out of bed, we're thrashing around in our pain, trying to understand it and judging it that we're not doing it right, right? And it comes from the idea of people fixing it for us. Nora McNerney wrote The Hot Young Widows Club, which is a great book, and she talks about people just want you to get better so then they can be like, oh, happily ever after, like, look at them, like, I don't have to check on them, I don't have to carry their grief anymore, I just want them to get better. And so that feeling of dismissal of the experience, unsupport in the pain, increases suffering for grievers. So what we need to understand is that we need to tend to grief with kindness. And we have to address suffering as something that can be supported, built into. So when we're talking about grief, we have to talk about from the physiological standpoint of grief, which is when something happens bad, there is a physical experience in the body. Bessel van der Kolk wrote The Body That Keeps the Score, which we use a lot at Gladney in adoption work, and it's talking about how we physically carry trauma in our bodies. And he talks about specifically to grief, when a really, really bad thing happens, our brain is trying to understand it. Our body physically is trying to understand the emotions and the experience and the gaping hole in our life when there is grief. And he talks about the importance of letting your body release that and letting your body experience that. Again, not stuffing it down, not dismissing it, not swallowing that lump in our throat, but letting our body physiologically experience grief. And grief is actually a very physical experience. You're going to see with your patients, with yourself, you're going to see lack of appetite, brain fog. You're going to see things like just general physical pains and ailments that will come. You're going to see, difficulties in maintaining daily functioning due to the body's not having enough energy, because your body is constantly trying to process and understand. So when we run against our body in stuffing our emotions and our feelings and grief, we're telling people to stuff their emotions and feelings and grief. Unaddressed long-term problems come to be because we are not processing grief and we are not letting our body process grief. So there's a double aspect to it. You're also going to see things like repetitive thoughts for our friends who are stuffers, who don't want to process it, and so they're trying to stuff it all down and not, verbalize the experience or talk about the experience that they're having. When I work with grievers, I frequently hear things about dreams. I love dreams. I love to analyze dreams. I like to wake up in the morning and try to figure out what that happened. That is not what we need to do when we are grieving, because our dreams are actually our brain trying to process and understand this gaping loss. And so, one of the first things when I hear a griever talking about, repetitive dreams or trying to understand what this dream meant, or, what was he trying to tell me, or, I relived that car crash, really and truly trying to help the griever understand what is happening in their body is really empowering. And I even like to use mantras with grievers. So to get them out of the loop of, did I do something wrong? What was he trying to tell me? This constant battle that they're having inwardly. I like to give them permission to do mantras, which for dreams, I always say, this is my mind trying to understand. My mind is trying to understand. And so when you're waking up from a bad dream, allowing your clients to understand that their brain, their physical body is trying to process and understand this grief, and just giving the simple permission of a mantra of my body's trying to understand. I'm carrying tension, my body's trying to understand. I'm not hungry, my body's trying to understand, right? So giving permission that not only is their mind trying to process it, but physiologically the entire experience is trying to understand. So providing the mantras for sure. We also want to talk about, understanding and helping grievers understand that people are going to say the wrong things and they're going to do the wrong things. And we're not going to make excuses for it, but helping them understand that, their sister might have said that really terrible thing about, well, one day you'll have another baby. Helping them understand that their mother-in-law cleaned out, your husband's closet when you weren't ready for his clothes to be touched. Right. And so helping them understand that culturally people are going to mess this up, and you're in charge of using your voice, and you get to use your voice to have this dictate of your experience, because I think there's a lot of permission needed in grief. So let's talk about the overall therapeutic way that we support grievers. And again, this is from a therapeutic stance. This is what I do with clients in session for private practice. This is absolutely tools, but this can be applied to anyone, so you can use any of these tools. So one of the first things that we want to do as someone who loves a griever, specifically, as a therapist, is we want to use proper monitoring and evaluation. We want to use proper case formulation. I also need to point out that these graphics were developed, I think, by the WHO in response to coronavirus, but they're doing some pretty cool graphics. So these graphics are from that, not the tree, but. So we want to really look at the case formulation of who this person is and what their experience was. So again, allowing space for grief to be grief and not judging the person's experience with it or what type of grief it is, whether it's ambiguous loss, whether it's death grief, whatever it is. So we want to understand the experience, and as we're listening to the experience, we want to listen for themes. So we really want to listen for, repetitive statements, repetitive thoughts, in results of this loss. We want to understand the relationship that this person had to the loss. When I worked with adoptees in our post-adoption department, I would get a lot of calls of adoptees who were getting married, starting a family, and had never had, a connection with a birth parent, but now were really desiring that because their relationship with their birth parent, was something that they were craving out of newness of the relationship of their own grief and their own new experience and becoming a new mom, a husband, whatever that looked like. So understanding the relational need of the loss. And we're going to look at maybe other events that are happening at time of grief. So, did this 18-year-old, just graduate high school and was about to go off to college before their dad, got in a really big wreck? Did, this person have a divorce, as soon as they became an empty nester? And so looking at roles and identities and how the grief impacted the overall experience of that person. We also want to look at how the loss occurred. So we see here some really strong research with complicated grief, which I'm going to touch on today. For individuals who have a very difficult time with disruption in their life, they typically have been grieving for an extended amount of time due to traumatic caregiving of the person that they lost or the relationship that they lost. When we're looking at research with cancer patients, the diagnosis, the treatment, all of the pain and hardship through that was a grief experience. And then a separate grief experience if that patient passes away, right? So the difference is in maybe even the grief experiences and how that person was supported in those. And again, we'll touch back on complicated grief in just a little bit. I'm always listening for what was the most troubling aspect of that loss. You'll see this a lot of times in grief loss with death, where there's, if they were involved in that car wreck and they made it out, but that other person didn't make it out, if they had a miscarriage and they emotionally processed it much different than their husband, right? If a, birth mother was parenting a child and then had to place the child that she was pregnant with, right? So looking at what the most troubling or difficult experience was for the person that endured this loss. And always being really aware that when we're looking at the full picture, understanding that there's other attributes than just symptoms of grief. We're wanting to look at the whole person, not just the grief, because when I'm assessing grief patients, a lot of times there are things that come up that are a lot more troublesome or needing to be dealt with immediately than the grief processing. So being aware that we might need to change up our treatment or change up the way that we're looking at this person due to an immediate presenting need like suicidality, like an eating disorder, like something that could medically endanger them, or stabling them on meds before they can process the grief experience. So making sure that we're looking at the whole picture of them. So I talked about this in our last webinar, but I think it's really important to talk about grief in a whole with depressions and symptomology. Symptoms of grief are similar to anxiety and depression. And so you want to make sure that you're not overdiagnosing or underdiagnosing. You want to make sure that you're looking at the person and their symptoms for what they are, and that you're exploring, questions and trying to understand. I think the really cool thing that we hear from grievers in the literature is that they just want someone to ask them questions, and they don't want to be told what box they fit in. And so the cool thing about assessments with grievers is that they are open, and that they are wanting you to try to understand their experience, because typically people are just putting their own experience on them. So my personal experience professionally with grievers is that they are very much okay with talking about it and talking about their experience, because they feel free that someone isn't making up these things about the experience. So with symptoms, we're not going to rule out depression. We're not going to rule out OCD. We're not going to rule out anxiety. We're going to know that that could be covered up by a grief diagnosis. We're going to ask about previous mental health diagnosis, previous mental health stays, previous medication prescribed to the griever, and previous suicidality, and looking even at the current suicidality and where the person is. When I am looking at symptoms of grief, a lot of times what I'm hearing is an intense yearning or longing, emotional pain, physical pain, things that might, if I didn't know that this person experienced grief, that I could check off all the boxes for anxiety, could check off all the boxes for depression. So just being really, really careful how we are diagnosing and what we're diagnosing. And if you're more interested in that, again, that was really heavily addressed in my last webinar, of trying to differentiate those symptoms. I am an attachment-based therapist. I think that understanding the roots makes sense for the whole picture of a person. So I absolutely in every intake want to understand the personal history, like I talked about risk factors with previous mental health diagnosis, but also looking at the attachment style that that person has, what their caregivers, how they responded to their needs. Were they able, was someone able to hold space for that person? Or are you the first person to do that for them? So we want to look at attachment styles and attachment caregivers. So did the person lose, their primary attachment figure? Did the person lose their defining moment, and how they conceptualize their life, and where those support systems are? And I think it's really, really important to immediately understand from the lens of Maslow's hierarchy of needs. Are we worried about their electricity staying on? Are we worried about them getting groceries tonight? Is there childcare supports in place where your person can just go and cry, or do we need to put in some buffers that protect our individuals who are grieving? If you are familiar with Maslow's hierarchy of needs, we cannot get to the top tier, which is self-actualization, if we are worried about our electricity staying on tonight. And so really and truly looking at the basic level of needs, and how we can walk alongside that griever and getting those supports in their life so we decrease suffering. And then we're definitely going to look at religious and cultural implications of grieving, what the culture is, dictating on them upon grief rituals, or how long they get to grieve, or how they grieve, or how this, ceremonious ritual occurred in honoring a death loss, or if society says, blood is thicker than water, you have to stay true to your family, and we have an estrangement. So really looking at the whole picture of how that family's communication and understanding of the world and what grief is in their life, I think is really important. So once we understand all of those things, and once we ask all of those things, which this can be a 2 to 3 session therapeutic response, we try to integrate that with our treatment. And so when we've listened for the themes and we've listened for what those needs are, we're going to go into how we walk with that person. And so treatment looks a lot like, what does this person need? I think that when we're looking at how we treat grievers, we are looking at the lens of empathy. I put Morgan Harper Nichols' quote of empathy over here. She's a wonderful, wonderful poet. And it's just so beautiful that I also think it's an immediate reminder to ourselves as therapists that we may have walked the same grief, or as humans, we have walked the same grief, but we do not know this person's journey. And so just allowing yourself to, try to sit in this space of holding space for them however they need it to be. I have a lot of people that come to process grief, in my private practice setting or an adoption setting, that it's not after the person dies, but it's, I'm getting married, I'm pregnant, my children are leaving the home. And so really just looking at, why are they coming to treatment? What are they needing, and how are they needing you to walk alongside them? So one of my biggest things that I like to do in a really low level way in session is just to try to understand how to co-regulate with a griever. I've had clients say, my mom used to hold me in this way, or, I don't have a best friend to talk to or to process. And so just having a space that is warm, that is soothing, that they can just be in and not have a feeling or statement judged is really, really important. So when we're talking about loving on grievers, it could be light touch. It could be that you just have really regulated breath with them, that you're doing slow breathing, that you're calm, that your presence is open, that your hands are open, that you're not, crossed, or that you are just open, and that your face is neutral, and that you are just allowing the experience of being to happen in your presence. That can be done with a soothing voice. That can be done with supportive silence, which makes us all very uncomfortable because, again, that desire of just to fix things. But magical moments are made in those silent moments. Maintaining eye contact, expressing that you're there, and that can be physically expressing it. That can be expressing, during someone's hysterical crying fit of, this is terrible. I'm right here. It's okay to be upset. This is awful. You are doing what your body needs you to do, right? Just affirmations. And through that, when we look at, what regulation looks like, it really is when we have a newborn and we're doing this, right? That shh, 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 that soothing, right? Bringing them close to chest where they hear our heartbeat. We're doing the same things for our grievers. We're holding them with grace, with patience, in the depths of their darkness. And we're just saying, shh, 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 it's okay. You've done hard things. You've got this. I'm right here. I'm not going to leave you, right? Just that holding of that beautiful space. And it sounds so easy and it's so uncomfortable for us. So learning how to hold that space for someone, practicing how to hold that space for someone. When I start working with grievers, I want to create grief rules. Not to tell them that they are or aren't doing things right, but there are some basic things that we need to implement to help grievers feel safe. And so that's going to look like safety first. If you have been crying your eyes out, you need to pull the car over. If a piano fell from a skyscraper and landed on you, or it was going to land on you and you weren't going to move, you probably need to stay home today. You probably need to call your therapist. We need to teach grievers that they are allowed to cry all day, but we need to give them safe structures to do that in, and ways to buffer and support, especially for our grievers who are parenting, especially for our people that are like, I'm just going to work through this. It's going to be fine. Something's going to break. And so how we create safety for them physically and felt safety, which Dr. Karen Purvis talks about, the feeling of I can be who I am, what I need to be, ask for what I need in this space. We need to create and generate that for our grievers. One of my rules is you have to drink water. You're crying a lot. You're going to get dehydrated. I need you to make sure that you're getting food in your body a few times a day, and water needs to be going in, right? So have a full water bottle. Water needs to come in. You're crying a lot, and that's okay. But you got to replenish it. You got to take care of your body because your body's also grieving. And then we're gonna always help our grievers say no to things that make them feel terrible. It's going to be through talking about boundaries. That's going to be through not being around people that they don't need to be around, that are going to take their grief experience from them. We're going to create these things that help them feel cared for, supported, and safe. Megan Devine uses the vomit metric, which is gross. Sorry if some of you just got grossed out, but I think it's magical, because if taking off your wedding ring today makes you feel like you're going to vomit, don't do it. If going to your friend's baby shower today is going to make you vomit, don't do it. Don't do it. And you can come up with in your phone some statements that you can just shoot off to those text messages of people that need you, right? Like today, just, it doesn't work for me. My favorite phrase. It just doesn't work for me. I'm so sorry. Your gift's in the mail. I have to take care of myself today, right? So creating those phrases, those mantras that help people feel better. One thing that we see a lot with grievers is that they struggle with feelings of needing control, and they have no control because something really bad just happened that they had absolutely no control over. Or if they did have control of how some of this went, it didn't probably go the way that they wanted it to. And so they're desiring that control. And so a lot of times I like to help people map out their grief, help them understand why they started bawling, on the way to lunch, because they're like, oh, I can't control my emotions. But really and truly, they need to be able to identify the triggers in their emotions to help them prevent, that suffering. Whereas when they notice a trigger comes up that morning, they know, oh, okay, this is going to feel bad. And they're able to acknowledge it. And really process it for what it is instead of feeling like they don't have control of the experience. And this helps them create better boundaries of, oh, last time my mother-in-law came over, it was really terrible. And she really said some things that were really hurtful. And I probably just need a break from her, because 3 days later, I couldn't get out of bed. For 3 days, I was in bed all day because she came over, crashed my world, and I felt like I got hit by a car. And so really and truly just helping them kind of map out what they need and why they need it, because their brain is in fog. They don't really understand how to advocate for themselves at that point. Megan Devine talks about, again, that vomit metrics, and specifically when we're talking about that, understanding that there is worseness and that there is wellness. So the DBT principle is kind of this balance between bad and good, and understanding there's a middle path in that, and helping our grievers see that they did take care of themselves today and they did experience suffering and pain today, and that those two worlds can coexist. Joy and pain can coexist. And so sometimes having someone put, draw an X, a T, go back to first grade, draw a T in the middle of the paper, one side, things that were hard, moments that were difficult, the other side, how we survived the day. A lot of times people sometimes in this go to a gratitude practice of reminding themselves that there is still good in the world, but not forced gratitude, but just appreciation for, I got out of bed today and I ate lunch, and that was progress. So letting them see that yes, it is bad and painful, and you've done a great job, because our grievers are typically feeling like they're not doing a good job. And it also helps them trace to the idea of how to go away from suffering and into just experiencing pain. There's a practice in Buddhism and Buddhism has a lot of roots and work in grief. It's phenomenal. And when you look at some of the acts that they talk about and in the mindfulness and the awareness, there's a term, and I'm going to say it wrong, but Lupekka. I'm going to spell it because I probably said it wrong. It's Lupekka. And it basically is the act of staying emotionally open and bearing witness to the pain and dwelling in your awareness that you don't have control of it. Again, this might be grinding you funky because it feels funky. Sitting in the pain, being aware that we don't have control of the pain, you have limited ability to affect the pain, and letting the pain stretch out and giving it all the room it needs to stretch out. This is so much different for our grievers than trying to escape the pain. Trying to escape the pain leads to suffering. allowing them to see that they can stretch out in it, they can sit in it, and they can survive it. That they have done really hard things and they've made it through. And that they've experienced really difficult moments and that this is a really difficult moment. Letting them stretch out in that pain. Morabi Starr writes in Caravan of No Despair, we began to discover that the unbearable became bearable, and that by whispering yes instead of screaming no, an effable grace began to fill the space of our shattered hearts. Really seeing the pain and allowing yourself to gently and lovingly explore what it feels like to hurt in this way. Having compassion for yourself, that there is wreckage all around and there's no right way to do it, but allowing yourself to experience. They write that you're sitting in the fiery pits of hell and you're just taking deep breaths. You're allowing it to just exist. And when we do this, we see that we make it to the other side of that moment, right? We can think about that car wreck and we can think about how much we miss her. We can think about how we had no control over it and we can just be in that space. And you know what's happening? We're recognizing it, we're acknowledging it, we're allowing it to exist. So helping our grievers find space in that wreckage. How do we teach? How do we not teach? How do we walk with people in learning? See, I'm working this out myself. How we walk with people in learning that there's support inside the pain. How can you make this pain, this terrible, horrible, gaping disaster in your life, kinder and gentler to yourself, your aching heart? Asking people, what is it that you need in this gaping hole, in this deep grief, to feel like you can face the pain and sit in that burning wreckage? This is a great exercise for anyone who has a grief anniversary coming up, or Mother's Day or Father's Day, or just some kind of arbitrary, culturally dictated experience that just doesn't match the reality, right? How do we teach them how to sit in the pain and feel safe asking for what they need? And this is where we're going to go back to attachment work. We're going to understand, did anyone ever let them use their voice, ask for what they need? And if not, we're going to go to that, right? And we're going to re-walk through that. And we're going to allow ourselves to maybe be the first person that ever did that well for them, right? And what we're going to look at is what kindness looks like today. And I love to wrap up grief sessions with that. What does it look like to be kind to yourself today? How do you hold space for yourself to sit in that? Peter Ponce says, let me be to my sad, hereafter self kind. Letting ourselves just be kind. And a lot of times when we're thrashing around in that grief and trying to understand why we cannot get well and why these 5 stages of grief aren't working for us, it's because we're judging the experience. So letting kindness exist is so, so important. We're going to execute for our grievers some short-term and some long-term experiences. So short-term, very, very short-term, if I have a griever who's having extreme repetitive thoughts, if I have someone who is having to pull the car over a lot, I'm just going to want to work with them on soothing their own nervous system. Just like I talked about earlier, of holding that counseling room as that space of regulation, that co-regulation, we want to teach them how to do this for their body, right? How to soothe their body. And some strategies and treatments that we've seen that actually work really well is that creative outlet of expression, because in creativity, there's not a lot of judgment when it's happening. Now, how they view the cake that they baked or the art that they made after, like, that's up to them. You know, it doesn't have to be beautiful, it doesn't have to be wonderful, but the art of cultivating, nurturing, and growing something is actually a very, very beautiful thing. Megan Devine started a Write Your Grief course. They're actually taking enrollment. I think it starts in mid-July. She started a Write Your Grief course because she found that engaging in as little as 10 to 15 minutes of creative writing can actually decrease cortisol in people. Just a neutral space that asks them writing prompts. And you even see it in her book. She asks writing prompts that walks people through, experiences in their grief and asks them to, write that person a letter, or what would you say, and really guides them in this beautiful way that only comes from their soul. And it feels safe because it's just them. So we see things like art therapy, obviously, talk therapy, yoga, which is that mind-body experience where we are regulating that nervous system. Some people become great, cooks, busying themselves through cooking and seeing something beautiful that they can nourish other people with can become something that feels very satisfying to see. I want to touch on complicated grief, and then we're going to wrap up for today and take some questions. But complicated grief is very difficult. This is when someone has experienced grief and some type of clinically significant symptom of prolonged and acute grief impairs them in daily functioning. So that would be like if we just can't get out of bed for several months. That would be if we lost our job because we continued to no-show. That would be if our kiddos weren't getting dinner, right? And that there weren't enough support systems that were walking alongside that person. So we're going to be looking at also with this previous mental health history and diagnoses, which is why that intake assessment is so important. If I'm treating grief, I need to be aware that there's probably also some other symptoms and things going on. And so understanding that with complicated grief, there's a history of mental health, there's a history of trauma, and that this has combined with grief created a giant crater inside of the grief experience. So with complicated grief, we are looking at possible suicidality. We are looking at some self-harm experiences, and we are looking at higher inpatient stays. And we actually see the diagnosis of complicated grief increased for people that had to be caregivers during a crisis and during a loss experience. So we're going to be looking at maladaptive ruminations of troubling thoughts, continuing almost OCD thoughts of the experience, or completely opposite of that, excessive like dismissal, excessive swallowing that lump in their throat, excessive, inability to regulate themselves. And so it can kind of look all over the place. Complicated grief is only diagnosed 6 months after a loss experience. A lot of the research with complicated grief is specifically associated with death loss, which I think is kind of interesting. When I say that, though, I want you to hear me say that 6 months and you're done does not exist. But 6 months of this giant experience of I cannot get out of bed, I cannot go to work, I cannot eat, I'm losing, 100 pounds, like excessive experience coupled with a mental health diagnosis, coupled with, feeling like I just don't want to be here anymore if I'm not with him, right? Being really, really aware. So I love the Center for Complicated Grief. They have an entire manual. They have a multitude of assessments. And when I am measuring a person's kind of functioning and daily impairment with grief, I love to lean towards these tools because they give you a great holistic perspective and really easy measures. I think I bought it for $75. It's a downloadable manual with all of the assessments, and then they can send you printed off ones. So that is one of the resources that you guys have today. It is a phenomenal tool, and it's a very affordable tool, and I think that it's really important to anyone who's serving grievers. So that is something that I think you really need to have on hand if you're worried about that. Again, we're going to always be assessing suicidality versus longing just to be with that person. And so really getting a lot of training on understanding the difference of that, I think is really important. So I have kind of some last minute thoughts I'm just going to throw at you. But we want to, as someone who loves a griever, someone who sits with a griever, we want to be brave enough to say the person's name that was lost. Okay, We want to be brave enough to say when you placed your baby for adoption, when you miscarried. We want to be brave enough to say his name, her name, their name. We want to be brave enough to ask those questions about their experience instead of say, oh, I bet that made you feel terrible. Oh, Mother's Day is coming up. I wonder if that's, really complicated for you. We want to ask, Mother's Day is coming up. What is that like for you? So we're asking questions, we're wanting to understand, but we're not projecting. This is where if you have your own grief, which you probably do, you just want to check into that. Be aware that you might be projecting your own experience onto that griever. We want to lean in. We want to really be prepared to lean into that person and just be present with them. We want to really offer that safe space where we can co-regulate with that person. We do not want to be cheerleaders. It's going to be fine. I bet you can get pregnant again. It's going to be fine. You're going to find love again, right? Like those things don't feel good to grievers. And so we really, really, really want to be present, but not cheerleading. We can remind them this is terrible. And I've seen you do really hard things and terrible things. And I'm with you in this. I know you can wake up again tomorrow and fight the same fight, right? There's a difference in that empathy experience. We want to make tangible needs easy for them. Are we worried about electricity staying on? Pay that bill. Do we need to deliver dinner so she doesn't have to cook dinner for the kids again? Absolutely. Meeting those tangible needs and saying, I'm going here or here. What do you want for dinner? Right? Not, oh, what sounds good, but what do you want? Here are your two options. Making it short, concise, easy, tangible for them. And I'm going to leave you with my favorite quote from Dr. Pauline Boss, who is one of the lead researchers in ambiguous loss. She says, sadness is treated with human connection. So if this is your first dabble with grief, if this is the first time you've walked with someone in immense pain, just being there for them can be the treatment, can be the way that they find their way home, can be the way that they can integrate this terrible experience into chapter 2, because you just let it exist and you weren't scared of that. So I think that you guys have leaned into it today. I think that you have leaned into it by logging on today. I've dropped a few resources in your PowerPoint. I obviously don't have a ton of time for questions because I've talked a lot, but Gladney University is here to support you. We have a lot of podcasts on this for Reframed. So stay connected with us, like us on Facebook, write a review. And then I've dropped some of my favorite grief work for you guys to stay connected with. And my email's down there, and I would love to continue the conversation and continue supporting you in that. Jenny?
All right, we have a few questions. You good to take a couple?
Yeah, let's do it.
What do you suggest for patients who push grief away instead of embracing it and working through it?
So I, from an attachment lens, would look directly at, have they ever had a place in their life that it was safe to just feel things, or did they experience dismissal of their experience, or did they, go to someone with a need and that need got met, but then a different time that need didn't get met? And so I would look at their foundation of attachment to really try to work from that and how I could couple alongside and help them decrease suffering.
Perfect. Can you give an example of some mantras you use with your patients?
Yeah, so it really depends on what the trigger is. I think sometimes I see people who write on their intake sheet, I'm grieving, but then they don't bring it up in their intake until I ask about it. And so a lot of times it's really normalizing experiences. So you're getting married and your mom's not going to be able to be there, and that is really difficult, right? Where they're hearing me say, this is hard, right? And it's okay that it's hard, but I'm also not projecting an expectation from that. I'm just bringing it up for them if they're not able to look at it directly, if they don't want to look at it. I love to remind people that they have that things are difficult, because when I say it out loud, they're like, oh yeah, like this is difficult. And then following up that with, I wonder what this is like sitting in this difficulty, or what this is like. So I like to ask those open-ended questions where then they can teach me and what it's like for them. And then mantras, really and truly, like, I got out of bed today, that was my win, right? Teaching them what wins are, what new normals are, and having them even write it. I like to use Brene Brown's Manifesto of the Brave and Brokenhearted as an example of how they get to write their own manifesto for themselves. And that can be a really cool, just easy printable from her website.
Yep. And then last question, what is a good response to people that use faith or God phrases that actually hurt you? Like God won't give you more than you can handle.
Yeah, so this is probably one of the biggest things that I hear from grievers, and I feel in my heart that it is coming well-intentioned, but when we try to make that person feel like it is better, it's just not, it's worse. Because why would God do this to me is something that I hear. Why would I have to be punished in this way? And so just asking them questions like, I wonder, what this is like for you with your faith and belief system, where we let them say those hard, terrible things that they don't feel safe doing. And if someone says a hard and terrible thing to you, saying, it's not my experience right now. And you get to define however you explain that. So for me, one of my personal phrases in my grief journey has been, that just doesn't work for me. And then I get to decide how to elaborate it. But really building in boundary work and voice work where they feel comfortable saying, that doesn't work. That also specifically with loss is, if someone's coming over and like doing their laundry and they wash the last shirt that smelled like him, right? Like we have to help walk with grievers in how to use their voice and how to protect themselves from yucky statements that don't feel good and from yucky actions that don't feel good, because everyone's well-intentioned, but it doesn't mean that they do it right.
Last question, how would you speak to grief that stems from systemic injustice?
I mean, right now, yeah, well, like let's have that conversation. I'm seeing a lot about people just feeling tired right now, and validating that this is emotionally exhausting, walking up a really, really, really big mountain, that people don't believe that there's a need for change. I think it's important to acknowledge how difficult and how traumatic the experience of systematic injustice is. Acknowledging that really, I think, brings relief. But if we acknowledge it, sometimes I think that we think it'll make it worse when that's not true. We have to acknowledge the reality of the trauma that is occurring day in and day out with that systematic injustice. And we have to teach people how to care for themselves in that, how to feel everything so deeply and work to affect change. But my biggest thing that I like to tell people, especially with that systematic injustice piece, because we're having a lot of conversations right now in therapy, is you cannot pour from an empty cup. So you have to fight, but you have to fight well by doing self-care, and however that looks for you. We have to be awake to it, but we also have to pour into ourselves. So awakeness 24/7 is a reality for many, many, many people in this battle. But how we implement self-care to support is incredibly important.
Perfect. Thank you, Emily. That was wonderful. We had some great comments and feedback for you, which we'll give to you later. But thank you so much for talking to us about such a difficult topic that a lot of people really don't want to touch with a 10-foot pole. So thank you.
Yeah, thank you guys for tuning in. I'm just so grateful that we had so many people open to having this conversation. I think it's really cool.